Hey everyone, it's Dr. Rick, and one of my patients had messaged me saying that she is feeling really tired and has a lot to do in moving to a new house. Now, nowadays, a lot of people are on the SGLT2s and the GLP1s. These are two medicines that are made for diabetics, and the ultimate goal is to decrease your intake of calories and food. And it does help because more importantly, the GLP1s decrease the movement of the bowels. And when you slow down the peristalsis, the gut seems to keep more food in the stomach for a longer amount of time. And when it does, you'll have a sense of fullness prolonged, so you won't be that hungry. And nowadays we're just surrounded by all types of fast food places. I think I did a video once where I was driving from my house to my office in Bartlett when I worked for Advocate, and that's about 2 miles, and within 2 miles I would pass about 13 fast food places. So if I was hungry by the end of the day, my office hours, but going home, I'd be very tempted to eat bad things or make the wrong decisions. So we're all surrounded by that. And I think we have a plethora of problems with hyperpalatable foods. So one of the biggest things that will get you to lose weight is to decrease your intake. Now, the problem when you decrease intake, you also decrease fuel. So if you're trying to build up muscle, if you're trying to have energy and you decrease your calories to say 1200 from 1700 or from 1800, the idea would be if you can lose 500 calories per day over the course of a couple weeks, you will lose weight if you maintain your activities. But if you also have to increase your activities because of moving or getting the house ready to sell, or going on vacation and really exercising more than usual, or entertaining a 5K, you're going to hit the wall. And this is what I came up with my patient is it's okay to have a projected course in the long run of decreasing your calorie intake and maintaining activities, but if we have to crank it up a little bit, you might want to be taking creatine. This is creatine monohydrate by Bulk Supplements. That's my protein that you can get at Amazon Fresh or online. The creatine monohydrate has been well studied, and there's different forms of creatine, but honestly, they're all about the same. Subjectively, you don't have to worry like we did back in the 90s where kids taking creatine would have issues with kidney damage because the data has not panned out to say that's true. In fact, Rodriguez, or there's a scientist, a sports medicine scientist in Florida, who came up with a large body of evidence showing that there was no damage after about a year, and his athletes were going very high with their creatine dose. I just take 5 grams, and nowadays you don't even have to load. Usually in the 90s you would have to load up with a lot for about every day for about 2 weeks, and then you would maintain with 5 grams a day. There's data that shows you can get the benefits of just hitting 5 grams a day. For this, 5 grams is 2 teaspoons. I just put 2 teaspoons in here. I put about 30 to 40 grams of protein. Then I also include betaine by Creatine or Bulk Supplements as well. I think betaine is also a stimulant. I'll talk about that in another video. But this is what I would do for my patients that are on a caloric deficit and needing to get a little bit of energy. In the energy curve that goes from left to right, being 0 minutes and then being about an hour, you will benefit from creatine in the first minutes of your exercise routine. Then after that, you'll probably have to get your glucose stores or your fat stores if you're fat adapted. If you're not fat adapted, well, get that way. And if you're not sure what that means, get your insulin checked. A fasting insulin will tell you whether you're fat adapted or not. Not just the hemoglobin A1C. If your primary care doesn't allow you to get a fasting insulin or doesn't know what a fasting insulin is, then maybe get a new primary care. Because ultimately, I think exercise is is so important, has a treatment to lower all causes of mortality: heart attack, cancer, and neurodegenerative disorders or strokes. And I think that it's important to have exercise. Doses depend on what you're trying to get out of it. Even just with regards to osteoporosis, I think that the data shows that even into your 70s and 80s, you can still build muscle. And building more muscle helps you prevent the osteoporotic fractures. In fact, if you build muscle into your 60s, 70s, and 80s, you will slow down osteoporosis. It starts when you're about 30, sometimes when you're 20, the data shows, if you're a woman. And it just accelerates as you hit menopause. And I even have guys that have done that. And the thinking is that you'll be dangerously loading an older person with osteoporosis, osteopenia, with forward flexion kind of exercises. So we don't really do flexion exercises. And in fact, I'll show you what I did with my 70-year-old when I took him to the gym to show him how to exercise properly. I like to do something called 5x5s. And it's just 5 different exercises to do 5 sets of, and 5 different repetitions for every set. It's just easy to remember. It's a pain in the ass, but the objective is not to necessarily hit a 1 rep max. The objective is to get close to your 80% of your 1 rep max. You don't have to get into a forward flexion, because you will break something if you don't practice your form, and it's very important to have proper form. That's why you have to be taught by a proper nutritionist or an exercise physiologist or a sports medicine doctor like myself. If you don't have that, then you get to a physical therapist, but I find that physical therapists just get you back. In fact, most physical therapists that take care of hip fractures, they just get patients back to where they were before the fracture. And you have to understand that at the time of the fracture, several things got you there. It could be depression, it could be poor balance, it could be muscle weakness, sarcopenia, it could be weakness altogether from low testosterone, low estrogen. But bottom line is that we don't want to get you back to where you were before the fracture. We want to get you better than you ever were. So I don't care what age you are, and that's what I do with integrative medicine. Is I try to design lifestyles that will get you to postpone those 3 big killers, 4 big killers if you think about it. Any killer, all-cause mortality, if we can postpone all those things from happening to you. The average American male dies at 72, the average American female 78 in the US. And it would be nice if we can push to 80. I just spent going to Oahu, spent a week in Oahu visiting an aunt. At the end I visited the aunt, but we were trying to have as much fun as possible. And that took a lot of energy to keep up with my 20-year-old son, especially with his ravenous appetite. I didn't want to gain the weight that he probably doesn't gain, but we wanted to share time together. So bottom line is that I think it's very important when you're overweight to try to lose weight by decreasing your calories. And GLP1 inhibitors or GLP1 agonists do that. That's Ozempic, tirzepatide, Zepbound. They all work great if done properly. And you have to match the medicine with the type of exercise, and you should be exercising, and the caloric intake per day to manifest weight loss. But at the same time, you don't do that forever. Eventually, when you get to goal weight, then you have to start building muscle again, like you did when you were younger. That means you're going to gain weight on the scale, but it'll be mostly muscle, and you're not going to get bulky. It takes a 20-year-old a year to put on bulk. And if you're not an athlete and you're in your 50s and 60s, there's no way you're going to put on bulk in 1 year. It'll probably take you about 3 to 5 years, unless somebody like me shows you what to do and how to live the lifestyle. But if you're on your own, there's a lot of good podcasters and social influencers that can guide you. But in the end, it really takes somebody who knows the disease process. And that's why I think it's important for us doctors to understand how disease affects your patient or you. In addition, how you can take that person that's in front of you in the one-on-one that you're supposed to be doing for an hour, not 15 minutes. You can't get anything in 15 minutes except for writing prescriptions, but an hour of figuring out who's in the room with you, what has failed with them, what is their barrier, and how to get past it so they can get a better life. And it's a bad business model if I get people healthy, but I figured that's what I'm here for. So if you have anybody that's hitting the wall with energy or is really restricted on their caloric intake, good for them. But be careful when they start saying, I'm fatigued, I'm tired, I have no energy. It's not because the thyroid's off or your sleep is off. It's probably because your caloric intake is still low. So you can pop it up every once in a while, break that basal metabolic rate, always exercise. And if you're not sure what to do with your exercise or nutrition, maybe come and see me. I'll put a link to my website down below. I do integrative medicine consults virtually, so I can see anybody from anywhere. So hopefully this gives you a couple of ideas. I like creatine in bulk supplements because it was approved by Consumer Labs. As far as my protein, I just go and read over at Amazon Fresh a lot, and they happen to have that over there. But you can get this anywhere online. So as far as which protein, doesn't really matter. They're all about the same. As far as which type of creatine, honestly, I would go for monohydrate because it's the cheapest. And bulk supplements is super cheap. It's not pretty. I mean, it's just, it comes to you in a package like this in the mail. It's not a fancy bottle, neither is this, but I don't care about fancy. I care about the package that we developed from the fancy stuff. So please consider subscribing and sharing this with other people who are feeling tired. And if you have your ways that you get energized short of coffee, don't do too much of that, then put them in the comment section down below. Otherwise, consider subscribing, and I'll see you at the next video.